My name is Gabe Howard and I live with bipolar and anxiety disorders, and my story starts, well, kind of the same as a lot of people's stories start. I was really sick and I didn't know that I was sick.
But our winner is this man, who told about living in a private hell from undiagnosed polar disorder for 25 years until he finally wound up in a psychiatric ward, depressed, suicidal, and delusional. That's where his condition was finally recognized and treated. Through his speaking, writing, and podcast, he now encourages others to seek treatment while helping destigmatize mental health issues.
Even though I thought about suicide every day, and even though I was manic and I was depressed and I really had all of the symptoms of bipolar disorder, nobody recognized them. Eventually I got to the point where I just couldn't take it anymore and I formulated a suicide plan, and I ended up in a psychiatric hospital for suicide, delusional, and depressive thinking, and thankfully that's where I was diagnosed, and that's where my healing journey, for lack of a better word, began.
Winner of PVI's Hope Award and a $1,000 cash prize is Gabe Howard of Columbus, Ohio. Congratulations, Gabe.
They told me I only have 30 seconds, and I've just now spent 10 seconds of it complaining that I only have 30 seconds. We're now at about 20 seconds, so the best that I can really do is to say thank you very much. I was diagnosed in 2003, and when I was diagnosed with bipolar disorder, I really, truly, and honestly believed that I would become a ward of the state. And if I would have told my psychiatrist back then that, hey, listen, someday they're going to fly me all over the world and give me awards, that would have been a symptom. It would have gone in my chart and nobody would have believed me. So patients are right sometimes. Thank you so much. I ended up there by luck. I luckily ran into somebody that understood what happened to me and they took me there. I was lucky that I had the resources to pay for care. I was lucky that there was a bed available. And I was lucky that over the next 4 years I was able to work really hard to reach recovery with bipolar disorder. And all I can think of is, why did I have to get well by luck? I was able to fix the issues with my family, and I was able to fix the issue with myself, but it was all luck. And while I'm very happy to be well, all I can think of is, what if I wasn't the lucky one?